The situation facing the country is increasingly serious. Globally and at home, the number of cases continues to rise. As of 9 a.m. today, there were 51 confirmed cases in the UK, and it's becoming more likely that we'll see widespread transmission here in this country. Our approach is to plan for the worst and work for the best. If the number of global cases continues to rise, especially in Europe, the scientific advice is that we may not be able to contain this virus indefinitely. At that point, we'll activate the delay phase of our plan. Delay is about slowing the spread, lowering the peak impact of the disease, and pushing it away from the winter season. We are mindful of scientific advice that reacting too early or overreacting carries its own risks. So, subject to the primary goal of keeping people safe, we will seek to minimize social and economic disruption. The fourth phase is mitigate. We'll move on to this phase if coronavirus becomes established in the UK population. At that point, it will be impossible to prevent widespread transmission, so the emphasis will be on caring for those who are most seriously ill and keeping essential services running at a time when large parts of the workforce may be off sick. Our plans include not just the most likely case, but the reasonable worst case. We will identify and support the most vulnerable, and if necessary, we will take some of the actions set out in today's plan to reduce the impact of absentees and to lessen the impact on our economy and supply chains. We prepare for the worst and work for the best.
Jonathan Ashworth.
I'm grateful, Mr. Speaker, and can I apologise to you and the House for being